Greetings, listeners and learners. Welcome to our Midsummer of 2024, the third episode of Healthcare Headlines, a podcast summarizing the recent major healthcare news and what you need to know. I'm Dan Grauman, Managing Director and CEO of Veralon, a management consulting firm that helps clients with their most challenging issues in strategy, finance, M&A, physician alignment, and provider compensation. We also offer a virtual board education solution, which is a tech-enabled video-based governance education service for board trustees. This podcast will live on our virtual board education platform. So let's jump right in. First up, here's an update on the Chevron ruling and its implications. In late June, the Supreme Court issued a rule in the Loper case that ended Chevron deference, leaving interpretation of statutes administered by agencies up to the courts. Chevron deference gave agencies latitude on how to interpret the statutes they administer, deferring decisions to federal agencies rather than interpretation by the courts. Since Chevron deference was effectively ended by the Supreme Court, lawsuits are already being filed that will impact the healthcare industry. Fierce Healthcare reports that Hackensack Meridian cites Chevron's end in a new lawsuit over disproportionate share pay formulas. In the coming months, we'll see how complex policy decisions around Medicare Advantage, Medicare drug negotiation, consumer protections, and access to healthcare services will be impacted by the end of Chevron. S&P analysts anticipate regulations to take longer to draft and pass in the wake of the ending of Chevron. Next, hospitals are reeling from the impact of network outages. In late July, hospitals and other industries across the world were impacted by a defect in an update rolled out by a cybersecurity company. An issue in a CrowdStrike update for devices running Microsoft Windows severely disrupted hospitals, with lost functionality in Epic and many integral systems, including billing and imaging. These computer and network disruptions led to the cancellation of non-urgent procedures at many hospitals across the nation. How will health systems learn from this experience? It was different from a cyber attack, with some saying it was even more damaging. Next is an update on the Senate cybersecurity bill. Record-breaking highs in the number of data breaches were reported in the first half of 2024. In July, a bipartisan group of senators introduced legislation to prevent cyber attacks on healthcare facilities. The bill proposes to strengthen cybersecurity infrastructure with the intent to protect patient data and critical infrastructure of healthcare facilities. Fierce Healthcare reports criticisms that a cybersecurity expert said the proposals in the bill are redundant with existing actions already being taken. In our next story, big retailers are not succeeding in primary care, yet Humana's CenterWell is moving into some Walmart health clinics. The Wall Street Journal reports that Walmart's model of driving down costs through economies of scale does not work in primary care because you cannot drive down the cost of the product, basically the clinicians. Plus, they don't have an internal referral network for their primary care providers like a health system does. This doesn't mean that Walmart is shying away from healthcare, though. They plan to expand their specialty pharmacy business with an autoimmune-focused approach. Companies that believe they can succeed in care delivery are using what retailers have already built up to their advantage. Walmart's telehealth platform is being acquired by startup Fabric. Humana's CenterWell is opening clinics at locations previously occupied by Walmart. Corporate retailers' attempt to build scale in primary care delivery is turning out to be a benefit to competitors in the primary care delivery space. Next, even Optum appears to be dialing down on its growth, closing clinics in multiple states. In California, Optum is closing urgent and primary care clinics, infusion facilities, and medical groups. Optum is closing urgent care centers in Colorado and a clinic in Florida. Optum has also conducted workforce reductions in multiple states throughout this year. There are rumors that Optum is shutting down Landmark, a home health company it just acquired in 2021. These closures and layoffs across Optum are underway despite Optum revenues being up 12% compared to the same quarter last year. So in an update on private equity activity, you may remember from episodes of this podcast that Steward Health is a private equity-owned multi-state health system that declared bankruptcy earlier this year. The CEO of Steward was subpoenaed to testify before Congress. And in other anti-private equity activity by Congress, legislation was introduced in Congress that would require private equity companies to go through a vetting process prior to investing in a healthcare facility. They would need to set aside funds that would be available in the event of a system financial distress, in addition to other requirements. And last, rural hospitals and health systems face unique challenges in delivering and coordinating care. Rural healthcare organizations see value in working together and being interdependent. Through clinically integrated networks, rural healthcare organizations are able to work together to scale for value-based success where they would not be able to do so alone. Rural hospitals are also seeking to continue to reduce inefficiencies through an EMR approach. In Vermont, a hospital CEO suggested a statewide rollout of Epic to allow hospitals in the state to better communicate with each other and to reduce inefficiencies. Earlier in this podcast, we discussed the Chevron deference. It is possible that hospitals too big to be considered a critical access hospital and too small to be a rural referral center could sue the federal government to revise criteria for the critical access hospital program. This could increase reimbursement to those in-between facilities that don't fit existing to critical access hospital or rural referral center criteria. So that covers the major healthcare headlines for the past month. The one constant we can count on in healthcare is change. So tune in next month for new developments in episode 4 of Healthcare Headlines.